She opened her eyes in the recovery room. The nurses were smiling at her, but she had no idea who they were, or where she was, or why everyone kept calling her by the wrong age. She was 15 years old. At least, that's what her mind told her. The calendar said she was 45. She had gone in for routine surgery, nothing complicated, nothing that should have affected her memory. But when she woke up, 3 decades of her life had simply disappeared. Her marriage, her children, her career, all of it felt like someone else's story. According to the medical records, she insisted she was a teenager. She asked for her parents. She couldn't understand why the doctors kept showing her photos of grown children she didn't recognize. The surgical team had never seen anything like it. The anesthesia had worn off completely. Her vital signs were stable. Neurological exams showed normal reflexes and motor function, but she remained convinced it was 1995. The psychiatry team was called immediately. They ran every test available: CT scan, MRI, EEG, blood work to check for metabolic abnormalities, toxicology screens to rule out unexpected drug interactions. Everything came back normal. Her brain showed no structural damage, no bleeding, no signs of stroke or seizure activity. The scans looked exactly as they should for someone her age, but her mind had created a different reality entirely. The psychiatrist documented her responses carefully. She could recall her childhood in vivid detail. She remembered her high school classes, her first job. Everything up to age 15 was intact and accurate. But after that, there was nothing. When shown photographs of her wedding day, she stared blankly. When her adult son visited, she recoiled. She didn't know him. The medical team tried multiple approaches. They brought in familiar objects from her recent life. They played videos of family gatherings. They walked her through documented timelines of the past 30 years. None of it triggered recognition. She listened politely, the way you might listen to someone else's autobiography. But she couldn't connect any of it to herself. Days passed, then weeks. Her memories did not return. The psychiatrist documented something unusual in her behavior. She wasn't distressed by the gap. She didn't grieve the lost decades. Instead, she seemed genuinely confused about why everyone was so concerned. From her perspective, nothing was wrong. She was exactly who she had always been, a 15-year-old girl who had just woken up in a very strange hospital. Her family struggled to know how to help her. How do you explain to someone that they've lived an entire adult life they can't remember? How do you prove to them that the person in the mirror with gray hair and laugh lines is really them? Her husband would sit beside her hospital bed and tell her stories about their life together. She listened, but to her, he was a kind stranger telling her about people she had never met. But here's what made this case different from everything doctors expected. The amnesia was selective in a way that didn't match any known pattern of brain injury. Trauma-induced amnesia typically affects recent memories first. Older, more consolidated memories usually remain intact. This was the opposite. Her childhood was crystal clear, her adult life had been erased completely, and there was no physical damage to explain it. The neurology team realized they were looking at something far more complex than a surgical complication. What she was experiencing is a form of dissociative amnesia, a psychological condition where the brain blocks access to specific memories, usually as a response to overwhelming stress or trauma. But dissociative amnesia doesn't typically occur after routine surgery, and it rarely creates such a precise cutoff point. The psychiatric literature documents similar cases, but they're extremely rare. In most documented instances, patients lose memory of traumatic events themselves. A car accident, combat experiences, abuse. The brain, researchers believe, walls off memories that are too painful to process. It's a protective mechanism. But in this case, there was no obvious trauma to protect her from. The surgery had been successful. There were no complications during the procedure. Clinicians initially theorized that the anesthesia might have triggered a latent psychological vulnerability. General anesthesia affects memory formation. That's well established. Patients often don't remember the hours immediately surrounding surgery. But those are new memories that never form in the first place. This woman had lost access to memories that had existed for decades. Memories that had been consolidated years ago. Studies using functional MRI in dissociative amnesia patients show something fascinating. The memories aren't actually gone. They're still encoded in the brain's neural networks, but the pathways to access them appear to be blocked. It's as if the brain has locked certain files and hidden the password. Some patients recover their memories spontaneously. Others regain them gradually through therapy, but some never recover them at all. Treatment options are limited. Psychotherapy can help in some cases, particularly approaches that address underlying psychological stress. Hypnosis has been tried, with mixed results. There are no medications that specifically treat dissociative amnesia, because the condition isn't caused by brain damage or chemical imbalance. It's a functional disorder. The hardware is intact, but the software has malfunctioned. What researchers cannot yet explain is why the brain chooses these specific boundaries. Why did her mind draw the line at age 15? Why not 10 years of memory loss, or 20? And why did the anesthesia, a routine chemical process used millions of times daily, trigger such a profound psychological break in this one patient? The medical literature offers theories, but no definitive answers. And then came a finding that changed how physicians understood this. Follow-up case reports documented that her memories did eventually begin to return. Not all at once, but in fragments. A smell would trigger a flash of recognition. A song would unlock a year. Over months, pieces of her adult life slowly came back into focus. But the process was unpredictable and incomplete. Some memories returned with full clarity. Others remained blurry, like trying to remember a dream. What this case reveals is how fragile our sense of continuous self really is. We assume our identity is stable because our memories form an unbroken narrative. But that narrative is constructed by the brain every moment. And under certain conditions, the brain can rewrite the story entirely. For months, she lived in two timelines simultaneously. The person she remembered being, and the person everyone insisted she was. The psychological strain of that dissonance is difficult for most people to imagine. Your reflection doesn't match your internal age. Your family are strangers. Your accomplishments belong to someone you don't recognize. Medicine still cannot predict who will experience dissociative amnesia, or when memories will return. The brain's protective mechanisms remain one of neuroscience's most profound mysteries. She opened her eyes in the recovery room that morning, expecting to wake up as herself. Instead, she woke up as someone 30 years younger. Her family watched as she slowly rebuilt the bridge between who she was and who she had become. If you lost 3 decades of your life in a single moment and had to learn your own history like a stranger's biography, would you recognize yourself when the memories finally returned? This video is based on real, publicly documented medical case reports and is intended for educational and storytelling purposes. It is not medical advice. If you or someone you know is experiencing similar symptoms, please consult a licensed physician. Medical mysteries. True cases every week.